Today I will be talking to you about Ramona T. Mercer, PhD, RN, FAAP, and her theory, maternal role attainment, or becoming a mother. Ramona T. Mercer started her nursing career upon graduation from the diploma program at St. Margaret's School of Nursing in 1950. She worked as a staff nurse in pediatric, obstetrics, and contagious disease for 10 years. She pursued her bachelor's degree in nursing from the University of New Mexico in 1962. She then earned her master's degree in maternal child nursing from Emory University in 1964. Next, she pursued her PhD in maternity nursing at the University of Pittsburgh in 1973. She then accepted a role at the Department of Family Healthcare Nursing, University of California, San Francisco, as an associate professor, and then became a full professor in 1983. She stayed full-time as a professor until 1983 when she retired. She's currently a professor emeritus in Family Healthcare Nursing, University of California, San Francisco. Becoming a mother was inspired by Reva Rubin, her former professor and inspiration. Rubin was well known for defining and describing maternal attachment. Not only did Mercer utilize Rubin's research, she also used Mead's theory on role enactment and Turner's theory on the core self. In addition, she used Thornton and Nardi's role acquisition process to help shape her theory. She also looked at the work of Burr, Lee, Day, and Konstantin Werner's developmental process theories. Mercer's work was also influenced by von Bartolemy's general system theory. Her model of maternal role attainment depicted in our book and later in the slideshow uses Bronfenbrenner's concept of nested circles to portray the interaction between mothers, their significant others, and their children. Maternal role attainment was done because Ramona T. Mercer thought that there needed to be a framework for nurses to provide quality care in mothers and bonding with newborns, including the mother's significant others. This theory can be applied to adolescents, older mothers, ill mothers, infants with congenital defects, high antepartum stress, cesarean deliveries, and for the fathers. Mercer believed that nurses are responsible for promoting the health of families and their children. Looking at major concepts and definitions of Mercer's theory are as followed. Maternal identity is defined as having an internalized view of the self as a mother. Perception of the birth experience is defined as a woman's perception of her performance during labor and birth is her perception of the birth experience. Self-esteem. Mercer, May, Furtick, and D. Joseph describe self-esteem as individuals' perception of how others view oneself and self-acceptance of the perceptions. Self-concept was defined as outlines self-concept or self-regard as the overall perception of self that includes self-satisfaction, self-acceptance, self-esteem, and congruence or discrepancy between self and ideal self. Flexibility is defined as roles are not rigidly fixed, therefore, who fills the role is not important. Flexibility of child-rearing attitudes increase with increased development. Older mothers have the potential to respond less rigidly to their infants and to view each situation in respect to the unique nuances. Child-rearing attitudes, defined as maternal attitudes or beliefs about child-rearing. Health status is defined as the mother and father's perception of their prior health, current health outlook, and resistance, susceptibility to illness. Health worry concern, sickness, orientation, and rejection of the sick role. Anxiety. Mercer and colleagues describe anxiety as a trait in which there is a specific proneness to perceive stressful situations as dangerous or threatening and as a situation-specific state. Depression. According to Mercer and colleagues, depression is having a group of depressive symptoms and in particular the affective component of the depressed mood. Role strain conflict. Role strain is the conflict and difficulty felt by the woman in fulfilling the maternal role obligation. Gratification satisfaction. Mercer describes gratification as the satisfaction, enjoyment, reward, or pleasure that a woman experiences in interacting with her infant and in fulfilling the usual tasks inherent in mothering. Attachment is a component of the parental role and identity. It is viewed as a process in which an enduring, affectional, and emotional commitment to individual is formed. Infant temperament is an easy versus a difficult temperament is related to whether the infant sends hard-to-read cues, leading to feelings of incompetence and frustration in the mother. Infant health status is an illness causing maternal-infant separation, interfering with the attachment process. Infant characteristics includes characteristics in the infant temperament, appearance, and health status. Infant cues are infant behaviors that elicit a response from the mother. Family is defined by Mercer and colleagues as a dynamic system that includes subsystems, individuals, mother, father, infant, and dyads, mother, father, mother, infant, and father, infant, within the overall family system. Family functioning is the individual's view of the activities and relationships between the family and its subsystems and broader social units. Father or intimate partner contributes to the process of maternal role attainment in a way that cannot be duplicated by any other person. Stress is made up of positively and negatively perceived life events and environmental variables. Social support is broken up into 4 areas as follows. Emotional support, feeling loved and cared for, trusted, and understood. Informational support, helping the individual help herself by providing information that is useful in dealing with the problem and/or situation. Physical support, a direct kind of help. Appraisal support, a support that tells the role taker how she is performing in the role and enables the individual to evaluate herself in relationship to others' performances in the role. Mother-father relationship is the perception of the mate relationship that includes intended and actual values, goals, and agreements between the two. The maternal attachment to the infant develops within the emotional field of the parents' relationship. The concepts are well defined and easy to follow. Mercer outlined the obvious relationships in her theory as the mother, the intimate partner, and the child. Implied is the family and friends, community, and society at large. The stages of role attainment can overlap and be achieved at different time frames for different families. It's influenced by stress, social support, family functioning, and the relationship between mother and father. Using Bronfenbrenner's nested circles, Mercer describes the microsystem as the immediate environment in which the maternal role attainment occurs. It includes factors like family functioning, mother-father relationships, social support, economic status, family values, and stressors. The microsystem is the most influential on maternal role attainment. The meosystem includes and interacts with persons in the microsystem. The meosystem interactions may influence what happens to the developing maternal role and the child. The meosystem includes things like daycare, school, work setting, places of worship, and other entities within the immediate community. The macrosystem refers to the general prototypes existing in particular culture or transmitted cultural consistencies. The macro system includes social, political, and cultural influence on the 2 other systems. The healthcare environment and the current healthcare system policies that affect maternal role attainment originate in this system. National laws regarding women and children and health priorities that influence maternal role attainment are also within the macro system. Mercer describes becoming a mother in 4 stages of role acquisition. Commitment, attachment, and preparation was previously called anticipatory. This stage begins during pregnancy, includes all the initial social and psychological adjustments to pregnancy. The mother learns the expectations of the role, fantasizes about the role, and then relates to the fetus in utero and begins to role play. Acquaintance, learning, and physical restoration was previously called formal. The formal stage begins with the birth of the infant and includes learning and taking in the role of the mother. Role behaviors are guided by formal, consensual expectations of others in the mother's social system. Moving towards a new normal was previously informal. The informal stage begins as the mother develops unique ways of dealing with the role, not conveyed by the social system. The woman makes her new role fit within her existing lifestyle based on past and present experiences and her future goals. Achievement of maternal identity was formerly called personal. The personal role or identity stage occurs as the woman internalizes her role. The mother experiences a sense of harmony, confidence, and competence in the way she performs the role, and the maternal role is achieved. The stages of role attainment overlap and are altered as the infant grows and develops. A maternal identity may be achieved as quickly as a month, or it could take several months. The stages are influenced by their social support, stress, family functioning, and also by the relationship between mother and father. Mercer's structure of theory is well-organized and congruent thoughts. Her concepts, assumptions, and goals are organized into a logical and coherent whole, making it easy to understand the interrelationships among the concepts. Mercer's theory is used in nursing education, research, and in practice. It can also be used in other fields like psychology, with families working towards maternal role attainment. This model shows Mercer's maternal role attainment, with the mother, child, and father's influences being in the microsystem and how they're all interacted in interrelationship. The outer circles are still nestled with the parent work setting, school, daycare, and the macro system being the transmitted cultural consistencies. The major assumptions made by Mercer include a relatively stable core self acquired through lifelong socialization determines how a mother defines and perceives events. Her perceptions of her infants and others' responses to her mothering with her life situation are the real world to which she responds. In addition, the mother's socialization, her developmental level, and innate personality characteristics also influence her behavioral responses. The mother's role partner, her infant, will reflect the mother's competence in the mothering role through the growth and development. The infant is considered an active partner in the maternal role-taking process, affecting and being affected by the role enactment. The father or mother's intimate partner contributes to role attainment in a way that cannot be duplicated by any other support system. Maternal identity develops concurrently with the maternal attachment, and each depends on the other. Nurses are the health professionals having the most sustained and intense interaction with the women in the maternity cycle, stated by Mercer in 1995. The nurses assess client situations and environment and identifies goals with the client. The nurse provides education, assistance with teaching, and supporting and providing care for the patient if they are unable to provide for self. Mercer's work has been well received by the nursing community and is taught in nursing practice, research, education.